by several members of, thank you, Allie. We are joined by several members of the Rhode Island Food Policy Council team, including Network Director Nessa Richmond, Board President Diane Lynch, Communications Manager Allison Montagnan, our Community Engagement Intern Elijah Smith, and Annie Underhill, who's with us as a research intern for the month of July as she's studying to become a registered dietitian. This meeting will be recorded so that we can share it afterwards. So each quarterly meeting of the Hunger Elimination Task Force has a theme to help us dig deeper into different aspects of food security in Rhode Island. Today, we are focused on innovative partnerships between healthcare and nutrition access providers. Before we begin, I'd like to thank the Hunger Elimination Task Force core partners, Rhode Island Department of Health, and our state's Director of Food Strategy, who's housed at Commerce, Juli Stelmaszyk. And I don't know if Randy Bellhumor was able to make it today, but she is one of our core partners at the Rhode Island Department of Health, and we're really grateful for her support. And now Juli will talk about some updates and announcements.
Thanks, Caitlin. Good afternoon, everyone. The Hunger Elimination Task Force, for those who may be joining for the first time, was established in 2017 as part of our state's food strategy, Rhode, with the mission to reduce hunger and increase access to healthy, culturally relevant food for all Rhode Island residents. It's facilitated by the Rhode Island Food Policy Council as a strategic partner and the Rhode Island Department of Health and Commerce. This is our third quarterly meeting for the year. So today we'll be hearing from innovative community-based programs that combine healthcare with nutrition access. Before we get started, I just have a few announcements. Last year, an ad hoc working group of the Hunger Elimination Task Force compiled a list of the organizations in Rhode Island providing home delivery of emergency and supplemental foods. The Rhode Island Food Policy Council has confirmed and updated the information for these organizations and is almost ready to publish this helpful document. It will include a state map showing where these organizations are located and also list them all in a table and by town. The resource will be posted on the council's website as soon as it's completed, and we'll make sure to send out an email to this listserv to notify you when it's available. Secondly, a new federal child nutrition reauthorization bill has been introduced called the Healthy Meals, Healthy Kids Act. The Child Nutrition and WIC Reauthorization Act authorizes all of the federal nutrition programs, including the National School Lunch Program, Women and Infant and Children WIC, and the Child and Adult Care Food Program. The Rhode Island Food Policy Council will follow this closely and keep the network updated. We also wanted to share that the Rhode Island state budget for FY 2023 has passed, and thanks to your collective efforts, includes $20 million for a grant program through the Rhode Island Foundation for nonprofits to provide food and housing assistance. We're currently working with partners to support the rollout of this program, and we'll keep you updated when we have more details, hopefully very soon. And lastly, part of our discussion today will mention the Unite RI platform, which is a new platform sponsored by the Rhode Island Executive Office of Health and Human Services, EOHHS, the Rhode Island Office of Veteran Services, and Lifespan. The tool is free for community-based organizations and nonprofits, so you can learn about Unite RI at the upcoming community information session on August 4th. The 2022 legislative session wrapped up in June, and Rhode Island Food Policy Council Board President Diane Lynch will now share a summary of the activity related to food access legislation. Diane, take it away.
Thanks, Julie. A few years ago, the Food Policy Council decided to create a bill tracker, which we keep on our website. There are about 2,500 pieces of legislation that get introduced every year, and we track all of the ones that could have an impact on the food system. So this year, there were 11 bills that were introduced that specifically had to do with access to healthy food and hunger elimination. And a few of those passed. There were some good wins, and I'm just going to briefly describe what they are for those of you that don't follow the General Assembly too closely. The really big win was the effort that was led by the Rhode Island Public Health Institute over the last few years, and many of you collaborated on that to introduce SNAP fruit and veggie incentives in grocery stores. And there were bills introduced, and then finally an allocation of $11.5 million was put into the budget for 2023 to fund that program. That program is going to be implemented by DHS. There is money in there to get it set up, and then there's money to actually pay for the incentives. So SNAP beneficiaries who are going to use their cards or EBT cards will get a 50-cent rebate or discount on every dollar that they spend on fruits and vegetables. And hopefully at the end of the year, when DHS can share the results of that, in future years, the General Assembly will continue to fund that. So that was a very big multi-year effort that actually was quite successful. Another win was Representative Julie Casimiro and Senator Bridget Valverde introduced and passed a bill that would reduce the paperwork burden on food pantries and food access points, not the Rhode Island food pantry, but smaller ones. And they do not have to register anymore. They had to do some paperwork with DVR to register as charitable organizations, and they've taken that off the plate. So they've actually kind of streamlined the paperwork for that. And then there was, like, as Julie said, there was the $20 million that got approved at the end of the season for food and housing assistance that will be administered through the Rhode Island Foundation. And there was also a $250 per child tax rebate that was approved at the last minute, which, although not targeted at food, is actually going to help families that do have food insecurity and need the extra money. The ones that didn't pass, there's been for the last 6 years an effort that's been led by Senator Sandra Cano and Representative Marcia Ranglin-Vassell to try to get a bill that would implement universal free lunches in all of our elementary schools and secondary schools. They've been trying that for 6 years. That did not pass again. I would just mention that there is a bunch of folks that are in the working group at the Rhode Island Food Policy Council that are going to see if they can try to boost that along next year. And that's it. That's the wrap up. Thank you.
Thank you so much, Diane, and thank you, Julie. I did want to give one more update. Last year, the Hunger Elimination Task Force had an ad hoc working group that was surveying food access providers in the state that provide home delivery, free and low cost home delivery. That's something that when I came on, they had all this great research, and we had Annie Underhill call those organizations to get an update, because obviously a lot has changed since last fall. So I know that everyone's been waiting for this. We will get this out very soon. We are just finishing up some final updates and design items, and we will send out an email when this comes out. So that's something to look forward to. And I know that since I've been here in late February, it's something that a lot of people in Rhode Island have asked for. So we're really excited to be working with partners to get this information out and of course update it as needed. So I am so pleased to introduce our panelists today who have agreed to talk about their programs with us. Jake Stanton is the Food Access Associate at the Southside Community Land Trust. If you haven't heard yet, the Southside Community Land Trust just opened up a beautiful new headquarters at 404 Broad Street. Has lots of exciting things going on, so be sure to check that out soon. Jake is here to speak about Southside Community Land Trust Veggie RX program that provides locally grown, chemical-free produce directly to clinic patients who are at risk of chronic diet-related diseases and food insecurity. We have Alyssa Gleason, who's the Executive Director of the East Providence Health Equity Zone. She's here to speak about the Produce People program that connects East Providence residents with diabetes that are experiencing food insecurity with fresh produce, resources, and education. We also have Carrie Bridges-Solis, who is the director of the Lifespan Community Health Institute, which houses the Connect for Health program. Connect for Health works to eliminate health disparities and promote health equity by screening patients at Lifespan clinics for health-related social needs, and provides navigation support to secure basic needs, including adequate food, safe housing, transportation, and a stable income, because we all know that food insecurity is linked to so many different aspects of someone's life. And our panel is facilitated by the wonderful Gary Bliss. Gary is the director of the Medicaid Accountable Entity of Prospect Health Services. He is also the co-chair of the Unite Rhode Island Steering Committee, which is dedicated to building a comprehensive statewide system to address health-related social needs of Rhode Islanders. It's also working on several initiatives designed to address food security and healthy food needs of accountable entity members. So take it away, Gary.
Okay, and that was the only decent recent photo of me. So thank you very much, and it is wonderful to see so many folks. Let's start with the first person who was introduced. Jake, why don't you tell us a little bit about the Veggie RX program and why you folks decided to start it up? What was the need, and how did you come to build the program to be what it is today?
Sounds good. Can everyone hear me okay, or is there an echo or anything? Okay.
We can hear you. Thank you.
Cool. Yeah, so our program, it's like a partnership between Southside and a few healthcare providers in the Providence and Pawtucket area to help get like healthy, fresh, nutritious food to the people that need it most in the community. We work with these healthcare organizations to identify folks who would be like at risk of like chronic health issues or food insecure. And then we have like a amount of money for each person bi-weekly that we can, you know, basically use to buy food for a share. And then we do food distribution like every other week. I wasn't here for a lot of the initial origins of the program. I've only been here for a year. But I think that it really fit within our organization's goals of both being able to like support the farmers that we work with, because we're buying all the food from local small scale farmers that are immigrants and don't really have the large connections to sell to, you know, like large organizations. And so like working with it on that side, and then also like helping to get the food into the community through working with the healthcare organizations.
Excellent. So I work in healthcare, so I'm able to say this. Healthcare organizations are not necessarily the easiest in the world to work with. We are large, we can be bureaucratic, and we have a ton of regulations that we need to live with. Can you speak to how your organization sort of overcame some of these challenges of working with healthcare, and what lessons you've maybe learned on how to ease some of those differences between the way a small CBO looks at the world and the way large healthcare systems look at the world?
Mm-hmm. Yeah, from my understanding, I think we started out very small scale. This year we're doing, it's close to like 250 shares every other week, but last year was about 150, 160, and the year before that it was 70. So we've started out slowly. We've been, I think at the beginning we were focusing on a connection with one clinic. And then we were reaching out to find other sources of money, just to kind of like diversify like the money that's coming in to support the program. So right now, we work with Integra, and I see Brady here from Integra, and so shout out to Brady, he's been amazing. And so with Integra, it's actually like the money that pays for the program is from Integra. But with Clinica Esperanza, it's from an outside grant from Bank of America. And then I know that we're also working with the Lifespan this year, which is new. And I think that that's grant funded. And so I think it's been just finding creative ways to find the money for these programs and to be able to fit it within the already existing structures that they have. And so like a lot of the programs that we work with, yeah, I think they're already like, we're seeing the patients we're delivering to are patients that are already going to be coming in or already going to be coming to the offices that we drop off at. And so it kind of like fits in seamlessly.
Excellent. Alyssa, can you tell us a little bit about the Produce to People program and how that got started and what made you folks decide that that is something that was needed to meet the needs of folks in the East Bay part of Rhode Island?
Yeah, so Produce to People provides bags of fresh produce and lean proteins to East Providence residents that are experiencing food insecurity and have diabetes. It got started out of the Diabetes Health Equity Challenge a couple of years ago and is now funded through Rhode to Equity, which is an initiative of the Health System Transformation Fund that the state of Rhode Island funds. And in East Providence, food insecurity was identified as being a barrier to health access, to health equity. And so were chronic conditions, especially diabetes, that relate to nutrition. So it started off as, okay, we're going to provide these bags, we'll provide delivery if needed because transportation can be a barrier. And along with the items, we'll provide some recipes. And it's really expanded over the last year and a half, almost 2 years, where we have a volunteer nutritionist that comes in and does cooking demos that provide suggestions. You know, we're going into the summer and we want to go into summer barbecues. What are some healthy ways to enjoy those, things like that? Partnering with URI, SNAP Ed to do an Eat Well, Spend Less class, and really taking the feedback from all of the participants into consideration each month. It's not a case of, oh, we're just going to put this list of items together and send out the bag. We send out the list of items ahead of time to the people who are getting it and say, okay, what do you think about this? What should we remove? What's going to be tricky for you to cook? And then we adjust based on that. And when we call them and say, this is what we want to do, these are our pickup times, or these are our delivery times, we'll do a little bit of case management light. You know, what is going on in your life? What did you struggle with this month? Are there any resources we can connect you with? And we do it in partnership with the EBCAP community health team and the EBCAP food pantry. So there's really that no wrong door approach to it, where if you talk to us, we can say, okay, you know what, we're going to connect you to one of our coworkers and they can help you with A, B, and C.
Excellent. So your idea preceded the pandemic when food delivery programs got a great deal of increased attention. Is that correct?
This program, it was happening right around the same time as the pandemic was getting started.
All right. And you'll continue it should we ever emerge, truly emerge from the pandemic. So it is not a pandemic driven program, correct?
Correct. Yes, we will continue it. And we're looking at right now, how can we take everything we've learned? How can we take all of this feedback and incorporate it into the food pantry's daily operations? How can we expand this so that way it's available to everybody who lives in East Providence and accesses the food pantry?
Excellent. And Carrie, tell folks here who might not be familiar with the Health Institute, sort of what the Health Institute is, and then zero in on what you've done on food insecurity.
Sure. Good afternoon, everyone, and thank you for having us as a part of this call this afternoon. So the Lifespan Community Health Institute I describe it as a mashup. We are the public health arm of Lifespan and community benefits. So I'm a public health professional. We deploy public health strategies to try to improve the health of the populations we serve, both those who cross the threshold and actually get services at a Lifespan facility, but also those who just live, work, play in our service areas, which, you know, with the footprint of Lifespan is really statewide. And we are community benefit as a not-for-profit system comprised of not-for-profit hospitals. We exist to provide care to all those who need it, with special attention to those who are experiencing the greatest vulnerabilities of our neighbors. And so I get paid, as I tell people, I get paid to drive business away from the system. I get paid to try to keep people healthy and happy in community and not have them need to use the hospitals at all. And one of the strategies that we manage for the system is a program called Connect for Health, which is our social needs screening and navigation support program. So we screen patients in some of our largest clinics for health-related social needs, including food insecurity. And we have a cadre of advocates. These are college and graduate level students and some community health workers who will work with caseloads of clients to help navigate their needs. We use the Unite Us platform, as was mentioned earlier, to document, that's right, Gary, to document need and to make electronic referrals, as both those in the network and those out of the Unite Us network. And we have observed an increase in food needs, particularly during the pandemic. So we've always had food among the top 3 needs in the time that I've been here at Lifespan, which is the last 7 years. But we've even seen an increase over the last couple of years. Now, we have also, out of our department, the Community Health Institute, been running food as medicine programs. We have a demonstration kitchen built out in our suite on Prairie Avenue in Providence, so that we can teach and run, cooking and nutrition programs. And, it's like being at a festival where you have a stage and someone's cooking and you can look in the mirror and see what they're preparing and taste samples and all that good stuff. We've been doing that for many years. And our food as medicine program, of course, had to flip to being delivered virtually during the pandemic, but that was actually great for us because we were able to reach a lot more people. We still did the programming, just did it over Zoom, and people could cook along at home. And we offer it in English and Spanish. Recently, we've expanded to add another offering under that umbrella called A Taste of African Heritage. Whereas our traditional food as medicine program is 4 weeks, A Taste of African Heritage is 6 weeks, but similar concept, teaching people to prepare healthy meals on a budget, but in this case, using ingredients that are more familiar to an African, in particular West African diet. And so we're excited to offer that. So the combination of saying, we're really invested in concerns around meeting food needs of our patients. We're seeing an increase in need. We have a taste of African heritage. We have food as medicine. We have a bunch of patients we've identified with food needs whom we refer to SNAP. We're a SNAP outreach provider. We assist with SNAP applications and WIC applications and refer to food banks and all that. But can we do more? And in working with one of our docs from Brown Medicine over at the Rhode Island Hospital Adult Primary Care Clinic, we came up with an idea to do produce prescriptions and reached out to Southside Community Land Trust and Gisandra Barros. I don't think Gisandra's on this call, but she's phenomenal and has been our liaison on this project. And said, let's be bold and let's ask people for money and let's purchase prescriptions for the summer through the fall. And that's what we've done. And so tomorrow actually is our second delivery, and 77 patients will be getting produce deliveries tomorrow.
And those will be to their homes or to neighborhood drop-off locations?
A combination. So most are coming here to our office, the Community Health Institute on Prairie Ave, and patients or their designee will pick up. But for those who don't have transportation, if we offer RIPTICs, if that doesn't work, because we have limited capacity, we'll do drop-offs, but we can only drop off but to so many people, given the staffing in our little LCHI van. If you see our van on the road, we're delivering produce tomorrow. So we do a combination and work with the patient to figure out what will work for them.
Excellent. Jake, I want to ask you a question sort of based on one of the topics that Carrie brought up in her conversation, where she talked about how they have worked to make and are making new innovations to keep their program culturally relevant to the people who are receiving it. Talk about how you have ensured cultural relevance in the food and information that you're providing to the folks you're working with.
Yeah, that's been a really interesting aspect of our program for how long I've been on to see it. All the farmers that we work with are immigrants. Most are either from Africa or from Southeast Asia. And so they already grow a lot of specialty crops, things that before this job I'd never heard of: Malabar spinach, sweet potato greens, chayote. Like I could list out like 20 things. So it's been a really delicate balance to balance like supporting these farmers who are growing very specific crops. And then also on the other side, we have the people that we're delivering to, which are from, all ranges of cultures and backgrounds. And so one thing that we're being consistent about this year is making sure that when we deliver the produce prescriptions, they have recipes included, so that people can, just from opening the bag, have 1 or 2 recipes that they can create with what's in there. And then we're also trying to coach our farmers to grow more like staple food crops, and so like saying like, okay, I know you're West African, you love to grow these tiny bitter eggplants, keep growing those for your community, but also grow us some big American eggplants because people will know what to do with that. And so it's a balance and a process that we're still learning and we're still engaging with.
Thank you. And before I jump to Elisa, of the fruit of the veggies that were new to you, what's been your favorite new discovery?
That's a really good question. I think cassava leaf has been my favorite.
Okay.
It's really hard to get at the markets. You have to go right when it's open, or you have to know one of the farmers because it doesn't grow well in this climate. And so that scarcity, and then also like the dishes you can cook it in, and it takes a lot of preparation because it has like, I think cassava has like cyanide or something in it if it's not boiled. And so it's just like a very interesting type of produce to eat.
I would say so. Yes, thank you. And Elisa, how have you seen over the time that you have been running this program changes in the food needs of the people that you have been working with? Have the people who have been showing up asking for help, or the people who get referred for help, how have they changed over time, or how have their needs changed?
So, and I think Carrie and Jake have said this as well, there's been just an increased need that keeps going and going and going for access to food. We're hearing more from people with questions. How do I keep my produce fresh longer? How do I preserve it more? That I think has been one of the biggest pieces of feedback, where people have said, okay, I don't want any of this to go to waste. I don't want to risk not getting to eat it. So can you tell me, provide some recipes on pickling things maybe, or preserving it? Can I freeze this? Can I freeze that? If I put this in the fridge, will it last longer? We've provided now some little kitchen tools that will help people to do things like that, or to use up, veggies or fruits that are almost on their way out, but not quite. Like, okay, you could throw this in a stew and use a little blender to puree everything, or you can make it into a smoothie. So that's been big. We've also heard from people about transportation. I'd say that was always a barrier, but we're hearing it more and more and more, that people are saying, I can't always afford to get to the supermarket. And if they're relying on public transportation, they can't necessarily go and stock up if there's a big sale. You have to find a way to get back and forth multiple times. And people are just trying to consolidate their trips as much as possible. So I wouldn't say the needs are necessarily changing. They're just increasing at such a significant rate.
Question, have you, how are you, and to what degree are you analyzing the health benefits of the food you are providing? So there is both nutritional insecurity, that someone is not getting sufficient nutrition. There can also be that someone is eating in an unhealthy way, and particularly if they have a chronic condition, their diet could be exacerbating that. Have you begun to sort of make the analysis between the food you're providing and better health outcomes for your participants?
Yes. So right now, everyone's self-reporting. It's what do you feel comfortable sharing? We're not putting pressure on people, but we're hearing feedback of my A1C has gone down. That's been a huge one. I've been on this program 6 months. I've been on it for a year. My A1C has gone down 2, 3, 4 points. People are asking more questions now about, can you put me in contact with a walking group? I feel more energetic now and I would like to go walking in my neighborhood. I don't want to do it alone, but can you put me in contact with them? It's supporting people in such a way that they're encouraged to take these positive steps that are going, like you said, outside of, here's some vegetables to make a salad with. It's okay, how can we look at these different pieces? Let's provide some access to a gym, to a walking group. Let's provide more access to social needs. That's what we've heard a lot too, is there's this social isolation that's been going on the last couple of years, and people take comfort in being able to eat food. And usually your comfort food is not great for you. Speaking as someone who would really eat ice cream every night for dinner if they could. Comfort food's not always good for you. So people are becoming more comfortable with themselves again and with engaging and interacting with others. So they'll say, okay, is there a peer support group I can go to? And that's been a nice outcome to see.
Great. So you're finding that the engagement with the food program can potentially open the doors for them saying, I'd like to talk about this, I'd like to talk about this, and deeper engagement.
Yes.
That's wonderful. Carrie, to what degree are you incorporating this kind of analysis between health outcomes and then the intervention that you are providing?
Yeah, so the criteria for inclusion, I mean, sadly, we have a lot of patients who could qualify for this support and a limited number of shares. So the inclusion criteria for our adult patients out of the primary care clinic at Rhode Island Hospital, which is actually not at Rhode Island Hospital, but on Chapman Street, includes the food insecurity and, known to the Connect for Health program, screened positive for food insecurity and have a diagnosis of diabetes and have a hemoglobin A1C above threshold. So we have worked through the list that way. And we had everyone come in. They had to have a recent hemoglobin A1C within a certain number of days. Forgive me for not remembering the exact number of days beforehand.
And these identifications are done by your medical staff, or they're done by patients raising their hand and saying, this is my.
No, so we actually pull from our electronic health record. So pull from LifeChart, which is our Epic-based system, and match that up with our Unite Us Connect for Health clients, patients. We use client and patient interchangeably. So they're both in our electronic health record with a diagnosis of diabetes and a hemoglobin A1C last measured as above threshold. And they're a Connect for Health client identified food insecurity. And then we call and invite them to participate in the project. And a condition is that if they don't have the recent A1C within our time look back window, they needed to come in and get another A1C measure. So we did that. So we have a baseline. And we'll be measuring at the end of the project at the end of November as well. And then we have a survey that we'll be doing with them to get not just measure the change on A1C, if any, but also just their experience with it. And we're offering, some recipes and invitation to do our Food is Medicine and Taste of African Heritage programs, other programs. So we'll ask them about which of these additional offerings they partook of, what they liked, what they didn't, etc. So we'll be measuring it that way. On the pediatric side, we had a wider net. And so we identified pediatric patients who had an identified food need in the household. We did not limit it to pediatric patients who had a diagnosis, but we did try to gauge through our work with our advocates and the client list, the severity of the food need. As well as as reported by the patient, the degree of success meeting the need in the last few months. So, there are some folks who, we met their immediate need, but it doesn't mean that they're doing just fine yet, and so we tried to gauge that as well and prioritize those patients to invite them to participate in the project.
Great. Now, how are you with the kids? It's not your average, say, 5 or 7 year old who does their own food shopping, does their own cooking, then does their own cleanup. Chances are there's an adult in the mix somewhere. How are you bringing in the adults in the household? Because you really need to have the whole family make behavior change. How are you addressing that issue?
Yeah, so we it gets confusing because technically the client is the child, but as you're pointing out, Gary, the child is probably not the one cooking and making all the decisions. They're not the one who's going to come pick up the food. So we work with the parent or guardian. And in the survey, the enrollment survey that we created with Southside Community Land Trust in partnership with them, we ask questions about if they grow their own food and what they're eating now, if they feel that they're consuming enough fruits and vegetables, what's getting in the way, so that we can track would they be interested in trying, and we list the different, produce, because to the extent that we can match interests, we'll try to work with Southside Community Land Trust to have those fat produce.
Just tell them to be careful with the cassava leaves. They got to boil
We'll be
them.
careful with the cassava leaf, exactly. And so that we can track, pre and post self-reported behaviors. And see if we have addressed any of those barriers.
Thank you. Jake, you're a creative person at an incredibly creative and dynamic organization. So as you look at your engagement with the healthcare system and with the intersection of food and health, what are some of the things as you look to the horizon, you look to the future, that you sort of saying, this is something we want to think about. This is something we'd be interested in trying.
That's a really good question.
That's why I make the big bucks.
I think that as of late, we've been trying to expand our program. We just moved into this new building on 404 Broad Street. Like, we moved all our stuff over on Thursday. So we're like very newly in here. And this space has a walk-in cooler, it has a wash pack area, so much more capacity than last year where we were really just stringing things together. So right now we're trying to really see how much capacity our new building has, how much capacity our farmers have. And then we've been very blessed to like get more sources of funding, you know, to work with Lifespan and to, you know, expand other programs. And so we're really just trying to see what that's going to look like and how much food we can get out the door. I haven't really been in charge of a lot of the planning for the future with this program. That would be a lot more of my coworker Jasandra. But I think that one conversation we've had is looking into ways to track like determinants of health. You know, and I think that can be kind of difficult because, you know, we are working with clinics and there's like levels of privacy and information that can't be shared. But I think that working to build out systems where we can see, you know, how is this affecting the patients that we're working with, could be, you know, very beneficial for, you know, if we need to slightly change course or adjust the way that we're going about it. And then also for finding more funding, because I know that there's some funding sources where they need, you know, explicitly like, how is this affecting your patients? So I think that's, you know, as we're still creating this program and building it up, that's probably the next big horizon for us.
Right. And that's where the partnership with healthcare is. If you are partnering with healthcare systems and healthcare providers, they have the access to the data. And while they can't share individual data, they can share aggregated data for the group. And then you can begin to demonstrate, you know, I hate the phrase, but it is important, to return on investment that you are all making. Alyssa, as you folks look at the work you have done and you look at the changing landscape, what are some things that you sort of have on your drawing board as potential future projects, right? Expansions, modifications, what have you?
Yeah, so some of the things we're looking at have to do with getting inside of the schools. We have a great relationship with the East Providence School Department. We're in one of the elementary schools one day a week during the school year, just as a resource for families. And we were able to work with them to expand their school garden. And we're looking at how can we do that across the city? How can we help expand school gardens, looking at that interest in fruits and vegetables from a very young age and support parents that way. And also, you know, we have a community focus in everything we're doing, not just in the sense of we want to hear from residents, but we want all of our initiatives to be community endeavors. It shouldn't be just myself and my team leading it. It should be resident led. And looking at places like the food pantry, looking at the school gardens, looking at the library as these community locations and changing the perception of accessing services. Sometimes people hesitate to access them, right? Because there's that stigma attached and damage can be done in the meantime. So how do we change that perception and say, hey, the food pantry is open for everyone. Just come by and pick up the food that you need. You know, the schools are having free and reduced lunch. If you qualify, take advantage of it, have breakfast. The library is having this service. Come by, stop by, see us. So how do we make sure that that's an important piece of everything we're doing?
Okay. Excellent. And Carrie, I know you are always thinking up new ideas. So what on the sort of the food and healthcare front are you looking at as you think about the future?
Yeah, I mean, in addition to, I'd like to do more of this and serve more of our patients. I mean, I'm excited about where we're starting. We've just gotten started with this particular aspect, but I'm excited about really kind of fully exploiting the possibilities of a continuum of supports around food-related assistance, from, you know, screening and education programs to, you know, kind of medically tailored prescription. I'd love to have a full-scale food pantry here at the Lifespan Community Health Institute. I have ideas on that. And similar to what Alyssa said, we're also looking at where we can bring our programming out into community settings. So we do, most of the work we do happens out in community, not here in our building. But in particular, we're also looking at working with education in Providence in particular, to bring the Connect for Health model to a school site or other community site, because it's like we're dealing with the same families that are touching the schools, that are touching our primary care clinics, that are, you know, working with HESAs, that are, and so trying to really make clear the continuum of support and provide the right support at the right time and place from the patient's perspective.
Great. Thank you very, very much. And I will just put in a plug for someone who on my screen appears 2 boxes below me, and that's Denise. Denise was with me yesterday afternoon, and we were measuring space at St. Joe's Health Center for shelves and refrigeration and the whatnot for an on-site food pantry. It would be tailored to the health needs of our clients there. So, you know, exciting work and exciting opportunities that we've got. And before I turn things back to Caitlin, I'll just put in a plug for those of you who are not yet familiar with Unite Us and with Unite Rhode Island. This is an incredibly powerful tool that can help all of your organizations and the people who come to you for help. It is, we adopted it at Prospect at this point now, I think about 2.5 years ago. It's now been adopted by the state with the intention of all AE programs to use it. And it is a super powerful tool for you to be able to engage with the community, and then also be able to help the people who come to you for food insecurity, for you to perhaps connect them to other resources. So go to a training, go to a community meeting, learn all about it. I think you'll be impressed with what you see. And with that, I will hand it over to Caitlin.
Thank you so much. Thank you to Jake and Alyssa and Carrie for being here and talking about your incredible program. And thank you to Gary for asking such thoughtful questions. That was wonderful. And I will follow up too. I don't work for Unite RI or Unite Us, of course, but it's an organization that I've been checking in with as part of my onboarding process. And I will say that the team really seems dedicated to talking about each organization, about your unique workflow needs, and if this referral process will work for you. So for those who have just joined, more recently, I did put the link to the next upcoming training. It's a free half-hour training just to get kind of the overview of the program, how it might work for you. And they do it once a month. So reach out to them. They seem very dedicated. And I believe that for nonprofits in the state, it's free to join. So thank you all again. So we will be going into breakout rooms. They'll be randomly assigned. Each room will have a facilitator to guide the discussion and take notes. And then after another half hour or so, we'll report back to this larger group. Allie, I think, already set up most of the breakout rooms, but it might just take a minute. So just be patient. And thank you again for joining, everybody. And thank you again to our panelists and to Gary. I really appreciate it. And we'll see you in the breakout room.
Gary, I had a question for you while people are still filing back into the room. Are you, like, how do community gardens get involved a little bit more? Because I've been talking with some of the folks that we work with, and they're interested in this prescription program, in the prescription programs in general, but they don't know how to get involved, and or what's that next step of connecting with the healthcare system, so to speak. How does that process work so we can better explain that to folks, or at least maybe connect you with folks who's interested, because then they want to be able to connect with the healthcare system so that they know they can bring it there, and then connect with organizations like Rescuing Leftover Cuisine to get the food to the systems, to get them out? How does that process work? How do we connect them?
Sure. So one simple way is I'm going to put my email address in the chat, and please email me because that is actually one of the things I want to do. And here's the deal with the Medicaid accountable entities. We have money that we have to spend, and we have to spend it on external organizations to address either health-related social needs, substance use issues, or behavioral health issues. So we are looking to make investments, and I'd be happy to talk to you about that and give you, then we can set up a one-on-one and talk about some other ways that you could do more. So I'll put my contact information in the chat.
That would be awesome. Thank you so much.
The key thing is the 2 R's in Gary.
Hi, everybody. Welcome back. All right. Allie, do you think everybody's back yet, or should I give it a minute? Okay.
Give it a minute. There's still one room or 2 rooms that seem active, so give them a sec.
Perfect.
I'll let you know when they get pretty empty.
Great. Thank you, everybody. We're just going to give it 1 more minute, and we're going to do a quick report out of some of the discussions. All right. Welcome back, everybody. Thank you so much for all the great conversations we had in those breakout rooms. We're going to ask each of our facilitators to share maybe 1 to 3 key takeaways of the discussion that you had today. I can go first. We kind of ventured off the discussion topics, but they were so great that I just went with it because I couldn't stop. It was just great. But we did talk about what from the panel discussion resonated with us. And Kim Gans from Brown, she had to leave early, but she had commented in the chat in the larger panel discussion about evaluation of these programs. She is willing to partner with some organizations to help with evaluating, but she also wanted to bring up the topic of evaluation in general for programs like veggie prescription programs. It's really important to capture the data to show how effective they are, both for individuals' health outcomes, but also for the food system at a larger scale. And that way people can learn about them and learn how to implement them better. Melissa Carden from REMA talked about how community members dealing with food insecurity are often disproportionately affected by natural disasters. So we need to think about how we prepare for that and deal with that, which I thought was a really great topic to discuss. Another key theme that came up a lot is just making it easier and more attractive for people who are accessing food and nutrition support services, just making it easier, more convenient, but also what can we do to reduce the stigma? So we talked a lot about making food pantries look more like supermarkets and doing some customer service and cultural competency training with volunteers, because it is hard enough for some people to get to these food pantries physically and mentally just to get there. And then if they have a bad experience, it's really hard for them to go back, and that's not what anybody wants. And we talked a lot about culturally appropriate food and how when you're surveying your stakeholders, your population about that, make sure it's an open-ended question. Ask what people want to eat, ask what culturally appropriate means to them, and don't assume what a certain population likes. I think that is most of that. I think that's the key themes we talked about. Julie, would you like to go next share what your group is?
Sure. Yeah, I can share just maybe 3 highlights. One thing that came up was that it's challenging in the discussion around kind of how are needs changing, if they are changing. And one of the things came up is that it's hard to know a lot of times because people might touch multiple programs, and often funding to evaluate the effectiveness of a program or evaluate the need is not included in the initiative. And so, you know, I think that begs the question, are there ways that we can build in more stakeholder engagement or evaluation to understand how we can better serve communities? Specifically, it came up with school meals was the example of, you know, last year there were 200 mobile meals being served and now there's only 68. And so why is that? Are they going elsewhere? Is the need less? It's not always what you would immediately think, but it's really hard to know. And so one way is just, you know, being here and being able to coordinate more with each other and understand. Another was this that came up from things that could be scaled up is this idea of wraparound services that came up in one of the panel discussions. So how can we leverage these partnerships better, perhaps through the HETF, to connect services in meaningful ways that kind of meet people where they're at. And then we talked a little bit about the medical field providing food access, and one of the gaps that came up was that doctors, medical professionals are not always trained in nutrition, and so they might not be as effective as you'd want them to be. People might be more resistant. It's kind of outside the norm. And so there's some opportunities there to integrate those two fields.
Thank you so much, Julie. Nessa, would you like to share your key takeaways from your discussion?
Sure. We had a great conversation. I'm happy for any members of our breakout room to add in. We started out just talking about folks were really gratified to hear how much the Unite Us platform has been helping, and just exciting to see it out in the field getting used and see those partnerships in action. Then we talked a little bit about how there's some of the need for food delivery has faded, but that there is still a strong need for really delivery of everything from fresh produce to medically tailored meals. And that there is a desire to see that everything that makes sense for continuation continue to be funded and be able to continue. In terms of concerns, we talked a little bit about programs being duplicated, not wanting needless duplication, but also the fact that sometimes things might sound duplicative, but in fact might be serving different geographically different communities, especially because people in Rhode Island don't like to travel to do things. And then the last part of the conversation was really about interest in scaling up the fruit and vegetable prescription program, an interest in scaling it up, but also being really clear that that scaling would need to happen strategically, especially if it was going to include federal funding that has some pretty significant reporting and evaluation requirements. So anything else? Just, I think, in terms of the benefits of working with the healthcare profession, just finding people who fit the profile of, who needs to be served, folks that are kind of above the SNAP line, but still struggling to afford the healthy food that they need for their families, and how healthcare partners have been wonderful in that respect, among others.
Great. Thank you so much, Nessa. Elijah, would you like to share one or two items from your breakout room?
Of course. So talking about challenges for the medical field providing food access was this, I think we had it just mentioned, the idea that the medical providers are not going to be able to fill in the full scope of what a given community needs or what a given person needs. So you need that ability to be able to bridge the gap between the patient and the medical provider, and we had the mention of community health workers bridging that gap, and they provide a good amount of advocacy for patients who are not necessarily aware of what they have access to and aware of what is available to them. So the need for advocacy was something that was really important that was brought up in our conversations, as well as I really wanted to highlight the need to celebrate the wins no matter where they come from. We heard about these programs that are providing wonderful access to the people in Rhode Island, and we need to be able to celebrate the wins that we're hearing and also learn from them so that we can see more programs like this pop up in the future.
Thank you so much, Eliza. Diane, would you like to share 1 to 2 key takeaways from your discussion?
Sure. Kind of similar to what Elijah just said, one of the points that came up early on was the work that is underway is so valuable. You know, how can we raise awareness about it? How can we make sure that more people know about it? We talked also about some challenges, and one of the major challenges is staffing and personnel. And so much of the success of a program is dependent on being able to get people who are good at it and be able to meet their needs as professionals as well as the community's needs, and how that is, you know, an ongoing challenge. Also, a very big shout out to Ocean State Job Lot, which has been a vendor, a retailer that's been able to supply, you know, really well-priced spices and grains and stuff like that. And many of the people in my breakout room have utilized them as a source for their cooking demos, to be able to get like the right ingredients or tell people where to get the right ingredients at a cost that's affordable. I don't know, maybe should I go on, or are you running out of time?
We're running out, but I love ending on Job Lot too, because that's awesome.
Yeah, shout out to them. Yeah.
Thank you so much, Diane. Annie, would you like to share 1 to 2 takeaways from your group discussion?
Definitely. So one thing we talked about for major challenges when the medical field provides food access is the topic of insurance, how that can be a tricky situation. For really, we want to help everyone that gets through the door. So that is an obstacle that we'll need to continue to work with and figure out how we can continue to reach and accommodate everybody that walks through the doors and just needs more help with food. We talked a lot about a commonality between these programs is just trying to find more funding so that we can continue to run them, reach more people. So that was the topic we talked a little bit about. And what's already been mentioned before is just data. So it's great that some of these programs have baseline data that they're able to work with from the start, but maybe figuring out a way so other programs as well can get access to similar data to see how successful programs are. And I think the rest we've already talked about a little, unless anyone in my group wants to bring up something too.
That's great. Thank you so much, Annie. I know one thing that's come up a lot is just this topic of evaluation, and I've seen it even in the short time I've been in this field, is just, I think, especially food access programs are just dealing with the day-to-day struggles of keeping open, serving their clients. Hard to find that time to step back and look at the whole picture and capture that data. But I know that, you know, it's really worth it when you can do it, and it's better to see how, it's helpful to see how it works with our whole food system. But I know it's hard to kind of step back, but that's something we continue to learn about. Okay, I'm going to share one more slide, but this concludes our Q3 Hunger Elimination Task Force meeting. Thank you all so much for joining us today and bringing such powerful discussions. Ali put a note in the chat. We'd love to hear your most important takeaway from this meeting. We'll definitely be summarizing the answers and all the discussion, sending out a recording. And next, our last meeting is October 18th. We'll be providing an updated state of the state of hunger in Rhode Island, and then the whole group will work together to plan the priorities for Hunger Elimination Task Force for 2023. So definitely save the date. Make sure you sign up for the Hunger Elimination Task Force newsletter. If you haven't already, I'll put that link in the chat. And thank you again so much for joining us today. We really appreciate it. Goodbye.